Welcome to the innovative modalities in cancer treatment.
The 5.9 centimeter mass was gone. I was actually, at this point, I was surprised myself, no? Huh? How can it happen in just a span of 1.5 months? So I asked them, what did your uncle say about this mass? Their uncle said that, yeah, indeed, the tumor was gone. It's just a cavity. It's not enhancing. So, it worked. Okay.
Right? Now you know. Cancer eats what? Cholesterol. Right? Simply Nature people can lower what? Cholesterol. Now you understand why you're taking the tablets? Make sense? Yeah, so more powerful than I tell you this miracle product. Just buy, eat, cure. No, we shouldn't do that, right? Because cancer is not a stationary disease. It keeps changing. So it's best that you understand what's happening. All right?
Especially if we are talking about solid tumors, the number one modality of treatment is surgery. Then to prevent recurrence, then we do the other adjuvant treatments like chemotherapy, immunotherapy, or targeted therapy, and also radiotherapy.
I have learned the innovative modalities that can be offered to my mom. Tapos on how to take care of ourselves also. Siguro si mom pwedeng sa powder, ako po pwedeng sa PPARS Plus naman.
Yes, I will invite friends and family members na umattend sa ganitong klase ng ano. Kasi masaya ako eh. Para bang ano, kasi masaya yung outcome, yung staff, helpful, friendly, plus yung yung panelist responsive sila sa mga tanong. Tapos very honest sila sa mga sa mga pagsagot sa mga questions. Basta nasasayahan ako. Ganun.
We're always with you from start to healing.
Magandang araw po sa inyong lahat. Ako po si Sheila, ang inyong host, at narito po tayo muli sa Simply Nature Success Stories. Napakapalad po natin ngayong araw dahil napaunlakan po tayo ng isang lung cancer patient na may very inspiring story na ibabahagi po ngayong sa ating lahat. Magandang umaga po, Ma'am Violeta. Salamat po sa pagpapaunlak niyo sa amin ngayong araw na ito. Maaari niyo po bang ipakilala ang inyong sarili sa ating po mga manonood?
Okay. Sige, salamat sa inyo. Ako po si Violeta. Magsi-67 years na ako. Na-diagnose po ako nagkaroon ako ng lungs cancer na stage 3C. Halos stage 4 na daw yun. Ay, nung 2022, nag-ubo-ubo na ako pero gumaling. Tapos nung 2023, inuubo na naman ako. Hanggat sa ang plema ko is may dugo. Hindi ko yun sinabi sa mga anak ko. Nilihim ko yung gawa nga ng akala ko TV lang. Mga buwan ng May, sinabi ko sa kanila. Alam naman nila yun na ubo ako eh. Pero sabi ko, hindi na maganda. Ang sabi ko, may dugo na yung ano ko. May dugo na yung plema ko. Di pina-x-ray nila ako, mayroon naman ng findings na mayroon bukol ang lungs ko. Ang ginawa naman ng doktor, naman ako, CT scan with contrast. Yun nga, nakita ang bukol sa sa lungs ko is malaki na. Hanggat sa napansin ko naman na mga buwan ng June o July, mayroon na akong nakapa dito mga bukol. Sa liig ko binayopsy. Hanggat sa dumating ang result ng biopsy after 2 weeks, hindi na maganda. Dahil nga sa mayroon akong lungs cancer, stage 3C. Ayaw ko kasi nagpa-chemotherapy noon. Pero dito sa bahay, nagpakuha ako ng oxygen tank, malaki. Hindi na ako nakakakilos kasi noon eh. Halos nakahiga na lang ako, pupunta ng CR, pagbalik ko salpak agad ng oxygen. Dahil sa grabe na nga. Talagang ang isip ko, kung anong gamot ang makakalunas.
Kayo po ay gumamit ng Simply Nature PPARS. Ano po yung mga naramdaman yung kakaiba o pagbabago?
Nung dati pa man, bago ako binayopsy, na nagsisimple nature na ako siguro mga mahigit ng 1 buwan, Maganda dahil yung dugo ng plema ko nawala doon sa PPARS liquid. Nawala yung dugo. Hanggat sa ma-biopsy nga ako, mabigyan naman ako ng yung gamot ng biopsy, magaan na ang magaan na ang pakiramdam ko kasi wala naman ng dugo.
Naisabay po ninyo itong Simply Nature PPARS dun sa GPT po, no, yung targeted therapy po na nasabi ninyo kanina. So, nagkaroon po ng magandang improvement sa loob po ng isang buwan, tama po?
Mula nung mag-PPARS liquid ako, na mga nakakailang box ako, nawala yung dugo sa plema ko. Yun naman ang guminha-ginhawa ako. Hindi, ang pagdating ng result ng biopsy at naresetahan ako ng gefitinib, ang bilis lang. 4 na beses lang akong nakainom. Nawala na yung ubo ko, nawala na yung plema ko.
Para po sa kaalaman ng lahat, ang isa po sa maganda sa Simply Nature PPARS is kapag po ito ay naisabay sa conventional treatment, kagaya po ng chemotherapy o kaya po prescription medicine po na re-prescribe po ng mga oncologist, ay may pagkakataon na mas napapalakas po natin yung bisa or yung effectiveness po, no, ng mga gamot na ito at mga treatment na ito, lalo na kapag kasabay po ng PPARS. So, I think ganun po yung nangyari po sa inyo. No?
Kasi bago pa man ako na diagnose ng may lungs cancer ako, ayon doon sa biopsy, nainom na ako ng PPARS liquid, saka PPARS ng tablet. Nawala yung plema ng dugo ko. May 1 buwan na rin. Ang ganda ng epekto sa akin. Ang sigla ko na, 1 buwan, 1 linggo. Hindi na ako nahingal, hindi na ako nag-o-oxygen.
Pero after po nun, so nagtuloy-tuloy po kayo ng gamit din po ng Simply Nature PPARS?
Hanggang ngayon, nag-Simply Nature pa rin naman ako for prevention na pampalakas din ng resistensya. Hanggang ngayon, nagiinom pa rin naman ako.
Pati po yung mga nodules o yung kulani po ninyo, no, o bukol sa leeg, ay nawala.
Nung nainom na ako nung gefitinib, yung mga bukol dito na nagdamihan, ang dami po na talaga dito ng bukol. Awa ng Diyos. Unti-unti na rin yun, araw-araw, kada umaga, kinakapa ko ang liig ko na wala. Pero tuloy-tuloy pa rin naman ng inom ko nung PPARS kasi yun nga ang nakakaganhawa sa akin. Pag nakakainom ako noon, medyo malakas, parang maginhawa bang huminga. Kahit may iniinom naman ako ng hindi na ako hindi na ako nag-oxygen. Kasi nga maginhawa na ang paghinga ko. Hindi naman sa wala akong tiwala sa mga chemotherapy, pero ang dami ko na kasing nakikita na mas lalong daming naaapektuhan ng chemotherapy. Kaya ang ayaw ko talaga ng chemo, hanggat maaari gusto ko na lang yung alternative medicine. Yun na nga, di naman din ako nagpabaya na inom ng binibilhan naman ako ng mga anak ko ng mga andaming mga herbal. Pero ang naramdaman kong mabisa o maginhawa sa pakiramdam ko ang PPARS. Kaya yun ang tinuloy-tuloy ko. Basta ako mahigpit akong sinasabi ko sa kanila, ayaw ko ng opera. Ayaw ko din ng chemo. Kasi hindi ko kakayanin na yun. Mag-antay-antay tayo ng panahon kung effective itong kasi ang tinira ko na lang, hindi na ako nainom ng iba pang mga alternatives. Sabi ko, ito na lang, dahil ito ang nakakaginhawa sa akin, PPARS nga.
Last January, nagkaroon po kayo ng CT scan. Ano po yung dumabas na sa CT scan ninyo netong January po?
Sa CT scan nitong January, ito lang 2024, is maayos na. Hindi na, wala na yung mga bukol. Kasi kahit si Doc Jansen naman noon, gusto niya na rin ako ma-CT scan para daw malaman, curious daw siya kung ano daw yung nangyayari na sa bukol ko. Maayos na, wala na yung mga bukol. Parang cavity na lang daw yung naiwan ng mga pinag-alisan ng bukol. Yun.
Dito po. So parang ito yung parang naging resulta po, no? Nung pag-combine po ninyo ng PPARS at saka po ng GPT po, no? This past months po. Ano po yung mensahe na pwede nyo pong maibahagi sa kanila sa mga katulad po ninyo na nasa kalagitnaan po ng cancer journey?
Laban lang. Huwag tayo mawala ng pag-asa. Ang cancer, nagagamot. May Simply Nature, may PPARS, maganda. Yun talaga ang naranasan ko na guminhawa talaga ako. Nung medyo inatake ako ng todo, gusto ko uminom kaagad, kaso lang inom ko lang. Dahil yun ang maginhawa sa pakiramdam ko na pag inuubo ako, nakakaginhawa naman talaga.
Ma'am Violeta, maraming salamat po sa pagpapaunlak niyo sa amin at pagbibigay po ng panahon para maibahagi niyo po yung inyong inspiring story po no, sa ating mga kapwa-pasyente na nasa kalagitnaan o may pinagdadaanan din pong laban against cancer.
Hi, ako si Violeta, 67 years old. Na-diagnose po ako ng lungs cancer, stage 3C. Dati po, hirap ako sa paghinga, naubo, at ang plema ko lumalabas, maraming dugo. Talagang hindi ko na rin alam kung paano. Nung mag-take po ako ng Simply Nature's PPARS liquid at PPARS tablet, maginhawa po ang aking pakiramdam at nawala po ang dugo. At sa ngayon, hanggang ngayon, maayos na po ang pakiramdam ko. I trust Simply Nature. Maniwala po tayo.
Welcome to the innovative modalities in cancer treatment.
The 5.9 centimeter mass was gone. I was actually, at this point, I was surprised myself, no? How can it happen in just a span of 1.5 months? So I asked them, what did your uncle say about this mass? Their uncle said that, yeah, indeed, the tumor was gone. It's just a cavity. It's non-enhancing. So, it worked. Okay.
Right? Now you know. Cancer eats what? Cholesterol. Right? Simply Nature people can lower what? Cholesterol. Now you understand why you're taking the tablets? Make sense? Yeah, so more powerful than I tell you this miracle product. Just buy, eat, cure. No, we shouldn't do that, right? Because cancer is not a stationary disease. It keeps changing. So it's best that you understand what's happening. All right?
Especially if we are talking about solid tumors, the number one modality of treatment is surgery. Then to prevent recurrence, then we do the other adjuvant treatments like chemotherapy, immunotherapy, or targeted therapy, and also radiotherapy.
I have learned the innovative modalities that can be offered to my mom. Tapos on how to take care of ourselves also. Siguro si mom pwedeng sa powder, ako po pwedeng sa PPARS Plus naman.
Yes, I will invite friends and family members na umattend sa ganitong klase ng ano. Kasi masaya ako eh. Para bang ano, kasi masaya yung outcome, yung staff, helpful, friendly, plus yung yung panelist responsive sila sa mga tanong. Tapos very honest sila sa mga sa mga pagsagot sa mga questions. Basta nasasayahan ako. Ganun.
We're always with you from start to healing.
Hi everyone, I'm Sheila and welcome to another enlightening episode of Simply Nature webinar. This program is brought to you by the collaborative efforts of Simply Nature International and Simply Healed Medical Group. Just to recap, last episode we discussed the imaging modalities for cancer detections. Lots of questions were asked and most importantly, were answered by our experts. And this week, discover how cancer patients can benefit from using PPARS because tonight's interesting topic is entitled Latest Cancer Treatment Immune Checkpoint Inhibitors. These groundbreaking therapies have revolutionized oncology by harnessing the body's immune system to target and destroy cancer cells. This approach has been said to show remarkable success in treating various cancers, offering new hope for patients with previously untreatable and resistant forms of diseases. We extend our sincere gratitude to each and every one of you for tuning in to this webinar, and we encourage you to share this online event with your friends and loved ones who also will benefit from the insights of our webinar tonight. Without further ado, let's dive in. Please note that we will be having what we call AMA or Ask Me Anything portion. So yes, questions are very much welcome. Do drop them on the comment section. Leading our discussion tonight are distinguished health experts. First off, I'd like to introduce a successful entrepreneur from a wide range of topics, from personal success to healthcare. He is the CEO and founding director of Simply Nature International, Mr. Shyan Lim. Good evening, Sir Shyan.
Good evening, Sheila. So good to see everyone. Welcome everyone to today's show. Today's discussion, the topic is a bit technical, but I think it's rather interesting. Just do your best. I think Dr. Jansen does a great job of trying to keep it simple. For any of you who are interested in immunotherapy, this is a good teaser or overview of what that is. All right. And of course, after that, there'll be an Ask Me Anything segment. So I will be there to answer your questions after the program. So I'll hand the time back to Sheila.
Thank you, Sir Shyan. All right, and now on to our next health expert. It's an honor to present our esteemed speaker, Dr. Jansen Kalalan, a distinguished graduate of St. Luke's College of Medicine. Dr. Kalalan is a diplomat of International Board of Lifestyle Medicine and Philippine College of Lifestyle Medicine, currently serving as a consultant at renowned institutions, including Alta Integrative Medicine and Wellness Complex, and Tree of Life Wellness Center, Centro Holistico, and Simply Healed Medical Group. Dr. Kalalan specializes in treatment of cancer and metabolic illnesses. Please join me in welcoming Dr. Jansen Kalalan. Let's all watch this.
Hi everyone, welcome to another episode of Simply Healed. We have with us tonight again Dr. Jansen Kalalan.
Hello, Shyan. Hello, everyone. Happy to be here again.
This is the third video that of a series where we talk about immunotherapy. And here we specifically talking about drug-based immunotherapy, not natural immunotherapy. And specifically, we talk about ICI, immune checkpoint inhibitors. So for all the patients who are undergoing or considering to undergo the immunotherapy, ICI immunotherapy, these 3 episodes will be very useful for your understanding. So today, Doc, we're gonna go on the basics. We covered a little about this on the first series.
Yes.
So now we're like sort of revisiting it and giving it a bit more depth. I think, Doc, that's an excellent strategy by you because if we hear it again, you're like, oh, I remember this.
Yes.
And now I understand better. So Doc, without further ado, let's go and jump into our topic. How does immunotherapy work in the first place? So that goes back down to our own immune system. Right?
Yes. So first, for us to be able to understand what immunotherapy is, we have to understand how the immune system fights cancer cells. Okay? So first off, when a cancer cell happens, okay, when there are cancer cells, okay, how does the immune system detect it? So we have something what we call antigen-presenting cells, which are also known as dendritic cells.
Oh, so that's what I always talk about. PPARS increases dendritic cell activity. So PPAR activates the pathways that make your immune system detect the cancer cell.
Correct. Okay. So when the dendritic cell detects the cancer cell, so it gets a bit of the cancer cell, okay, a piece of the cancer cell. Then it presents it to the immune system,
Okay.
specifically the T cells.
Ah.
Now, when the T cells receive this antigen from the dendritic cell, okay, it becomes activated.
Oh, okay.
Okay.
Yeah.
Now, I am activated. I will become a warrior. I will become a berserker. Then go
Go on a
crazy.
rampage.
Yeah, go on a rampage. When I'm activated, then of course the blood circulates, right? The
Yeah.
lymphatic circulates. Now, when the T cells go to the tumor, okay, now the T cells are able to kill the cancer cells. Okay, so basically this is how the immune system detects and fights off tumor cells. Now, what if the cancer cells evade detection of the immune system?
Then it's as good as your immune system not working.
Yes.
And that is why cancer tumors grow, right? Because
Exactly.
tumors
Exactly.
shouldn't exist. Your whole immune system is to prevent tumors from existing in your body. So the cancer cells have a sort of like a security pass that allows a gate pass that allows them to travel without restriction.
Yes. There are a number of situations where we might suspect that this is happening. So number one is you have undergone chemotherapy, radiation therapy, you have had surgery, then the cancer recurred. Or you did not respond to the chemotherapy, the radiation therapy. Okay? Those are one of the possibilities. Also, another possibility would be you've had cancer. You just have cancer. Okay? It's because your immune system was not able to kill off the tumor cells.
And
tumor
why?
And grow. Yeah.
Because your immune system couldn't recognize the cancer cells.
Yeah.
So doc, basically, if the immune system can recognize the cancer cell, it will kill the cancer cell.
Yes, exactly. So how does cancer cells evade the immune system? Okay, so there are certain cancer cells which express what we call as PDL1. So PDL1 is programmed cell death ligand 1. Okay, so remember, this receptor is expressed by the tumor cells. This is the one. This is the security pass of the tumor cells.
Oh, that's
okay?
the security pass.
Security pass. Okay. Now, on the other side, so your immune system, the T cells. Okay, what do they have in order for them to detect? Okay, this one does not have PDL1. I will go and kill. This one that does not have security pass, I will go and kill. Okay, so the T cells have what we call as PD1.
Okay.
The PD1 is their detector.
Okay.
Okay. Now, when the T cells and the tumor cells interact,
Yes.
okay, so when they interact and the tumor cell shows the T cells, this is my security pass. T cells will now
Scan it. Verify. Okay.
Okay, you're
You're
one
clear.
of us. You're clear.
Oh wow, that's why your
However,
cancer cell survives in your body.
Yes. So we now have what we call as an immune checkpoint inhibitor.
That's why the word checkpoint.
Yes,
You know,
the
it's,
word
it's,
checkpoint.
it's like the
Yes.
police checkpoint.
Exactly,
Yes.
exactly.
Okay.
So the immune checkpoint inhibitor, this molecule attaches on the T cell or on the tumor cell to block that interaction.
Oh,
Okay,
so
so-
you either block the scanner so that no matter what it scans is the enemy,
Yes.
or
Or you equip the.
okay, I got it. Let me give an analogy. You either put a blindfold on your soldier so that he attacks everything, okay, or you use something to block the security pass of the cancer so that his security is invalid.
Is invalidated.
Yeah, he
okay?
gets attacked.
Now
Okay.
he gets attacked. Okay, so this is basically how this specific immunotherapy works.
Yeah, it's so simple to understand now. Wow, it's very interesting. All the different things that we talk about from many episodes for the last 2 years makes a lot of sense when you just explain this part. So now, Doc, all the supplements that are on TV that tell us improve your immune system. They could be making your warrior strong, but your immune system is still totally useless.
Yeah.
Because the one thing that you want your immune system to improve doesn't happen with most supplements out there. It doesn't improve the detection.
Yes, exactly. So that's why a lot of natural supplements, although there are evidence that, let's say for example, turmeric, there are a lot of evidence that turmeric works against cancer cells. But how come
You can eat all the turmeric.
You can eat all the turmeric and your
Nothing.
cancer nothing happens. Still nothing happens because of this mechanism. And there are patients actually where you give them turmeric and cancer disappears. So, I mean, how do you reconcile that?
Yes.
It's because of this.
And here's the good news, okay? I'm the PPAR expert here. So PPARS is able to increase the dendritic cell activity, which allows the detection of the cancer. So if you've been eating turmeric and nothing's been happening, take PPARS and then you'll see the turmeric start to work because it's the mechanism that we're talking about. Wow, thank you so much.
So next, let's move on to what are the medications. No?
Yeah, what are some of the drugs you will be taking if you are going to go?
There are a lot of different drugs which are immune checkpoint inhibitors, no? But these are the most common ones. So number one will be pembrolizumab or your Keytruda, nivolumab or Opdivo, and atezolizumab. So pembrolizumab is mainly used for triple-negative breast cancer cells, triple-negative breast cancer,
Okay.
and hepatocellular carcinoma, but it's most studied in melanoma.
Okay.
Atezolizumab is for liver cancer.
Oh, that's important.
Yes. For atezolizumab, it's usually given in combination with another molecule. Okay, but we won't go into that already. Now, next one is nivolumab. Nivolumab is used for non-small cell lung cancer, head and neck cancers, and renal cell carcinoma. Okay.
Doc, we talked about how immunotherapy is the next wave of cancer treatment. In many ways, less harmful than chemotherapy. But there are still side effects
Yes,
for
that's true. That's true.
for immunotherapy.
Yes.
What are some of these important side
Okay.
effects?
Now, before we go into some of the side effects, no, let's compare this to chemotherapy.
Okay, that's great.
Okay, so for chemotherapy, we all know how bad it can get because your immune system goes down, your blood cells goes down, you know, everything goes down, even your hair goes down. Okay, so for immunotherapy, the side effects are much milder,
Okay, that's
but
good.
they are still there. Okay, the difference is the more common side effects for chemotherapy is hematologic or blood side effects.
All right.
Okay, immune system, white blood cell goes down, you become anemic, you have, you can have bleeding side effects, you can have gastrointestinal side effects, no? For immunotherapy, the blood side effects is actually rarer.
Oh,
It's
that's
much rare.
All right.
So, in immunotherapy, it's very important that your immune system does not go down or it does not become suppressed.
Yes, which is why it's important to notice that if you're going for immunotherapy, very oftentimes you're first prescribed chemotherapy. So it's so important that you protect yourself during the chemotherapy process, so that when you move to your next phase of immunotherapy, your immunotherapy will work. It's like really sayang or a waste of your resources if your chemotherapy hampers or diminishes the more expensive immunotherapy that comes after it. So what you can do is you gotta have an appointment with Dr. Jansen. Go and have an appointment with Dr. Jansen so that he can protect your immune system from the damages of chemotherapy, so that when you start using your more expensive immunotherapy, you have the maximum impact. Now, as to why you have to go for chemotherapy, even though it might compromise your immunotherapy, that's for another video, because that's another long discussion. But of course, your uncles have very good reason why you go for chemo first, then immunotherapy, even though you do compromise your immunotherapy with the chemotherapy.
Okay. So, in order for us to understand the side effects of immunotherapy, we have to understand first on how it works in the first place. So, let's review. How does immune checkpoint inhibitor work?
Security pass.
Security pass. Now, it's not just the tumor cells that shows the security pass or the PD-L1 receptor. There are also host organ systems that express this security pass, so that your immune system does not attack your own organ or attack
That is true.
your own body.
Because the T cells, the warrior cells, the moment they get activated, they run all over your body. They don't they circulate in your bloodstream.
They circulate. Yep.
So they could end up attacking everything. So that means then your body must issue security pass to all the other organs.
The healthy organs, the normal organs.
So so that your gangster, enraged berserker immune systems don't attack them.
Yes.
So if you disable the security pass
you end up
attacking your own.
So an immunotherapy side effect, very different from chemotherapy. Chemotherapy, because it bombards the system and it damages the blood cells. This one, you have a chance that your own immune system attacks
Your own body.
So the side effect, the possible side effects of immunotherapy is autoimmune disease.
Correct.
Which is like lupus. Lupus
Exactly.
is when your own immune system attacks your healthy cells, right? That's what lupus is. So since you disable the security pass, there's a chance your
Yes.
own immune system starts attacking
Exactly.
your healthy cells.
Exactly. Correct. So the main side effect of immunotherapy is autoimmune diseases. Now, we have a number of ways on how we can manage autoimmune diseases, but we're going into that later. First, let's describe first what are the different side effects specific to different organ systems. So this image shows you the different organ systems and the different diseases associated with immune checkpoint inhibitor therapy. Then there are more common side effects and the rarer side effects, as shown here in this table. So the more common side effects in immune checkpoint inhibitor would be gastrointestinal, endocrine, and dermatologic. So there are a lot, but I won't discuss them all.
Yeah,
So we focus on the more common ones. So gastrointestinal, like your nausea, vomiting, diarrhea, you can still experience those together with your with chemotherapy. So they are similar in that aspect. However, chemotherapy does not have endocrine side effects. Immune checkpoint inhibitor therapy has endocrine side effects, specifically hormonal imbalances, hypophysitis, so that's suppressing the function of your pituitary gland, thyroid dysfunction. So with this respect, you can actually experience symptoms of hyperthyroidism and symptoms of hypothyroidism. Okay, so it's very important for your doctor. If you experience these symptoms, it's very important to follow up with your doctor. Also, dermatologic side effects like rash, itching, vitiligo,
I think that's
white spots.
a simple reaction of your immune system attacking your skin,
It's
right?
like allergic reactions.
Yes, like eczema,
Yes,
psoriasis.
it's very similar.
It's an
Okay?
autoimmune response.
And dermatologic side effects are the most common one. So if you are someone who's receiving immune checkpoint inhibitor therapy and you experience these side effects, especially you have rashes, please go and follow up with your doctor. So because you might be experiencing a possible allergic reaction. Okay? And the rarer ones, so like your neurologic, cardiac, pulmonary, hematologic. So here, hematologic is rare in immune checkpoint inhibitor therapy, although it can still happen. Nephrologic, like your kidney, your immune system attacking the kidney, musculoskeletal, and ophthalmic, your eyes. Now, there are actually a lot of things that can make the toxicity more enhanced or more pronounced. So, what are these? For gastrointestinal toxicity, okay, please avoid taking antibiotics at least 2 months prior to the start of your immune checkpoint inhibitor therapy because this can affect progression-free survival and overall survival. So it has been shown that if you take antibiotics within 2 months of starting immune checkpoint inhibitor therapy, then the period of time wherein you are in remission shortens.
Wow.
And your lifespan decreases.
Wow.
Overall survival.
Wow.
Okay? So, please take note of that. For kidney toxicity, please avoid taking NSAIDs. So, NSAIDs would be like your ibuprofen, mefenamic acid, diclofenac, dextroprofen. Okay, so these NSAIDs, okay? So, avoid taking those. Avoid taking antacids as well, like your omeprazole, pantoprazole, esomeprazole.
Wow.
Okay? Because these can heighten or make the immune checkpoint inhibitor therapy more toxic to your kidneys. For pulmonary toxicity, asthma, COPD, and previous history of receiving radiation to the chest or to the chest area, these things can make the side effect of immune checkpoint inhibitor therapy to the lungs more pronounced.
Doc, when you share all this, I hope for our audience and for myself, I'm so impacted in the sense that we always we downplay how much your general health affects your cancer treatment. Because Doc, you talk about taking antibiotics. If you take antibiotics before going for your ICI treatment, your remission, basically your lifespan actually drops. But why would you need to take antibiotics in the first place?
Yes.
Right? Because you have other comorbidities, because you have your own immune system is weak and you got another infection, not cancer.
Exactly.
Right? So it really highlights that all these factors that will create side effects in your treatment comes from general health, right? So it's so important that cancer patients also know how to prepare themselves before you start your treatments, that you don't ignore the other general health issues in your body. They compound or basically they make it even more complex to treat your cancer, and some of them have a direct negative impact on your cancer treatment. So Doc, since we're talking about how to manage adverse effects of ICI, how do we manage the adverse side effects of ICI?
Okay, so management of the side effects of immunotherapy would be very similar to how we manage autoimmune diseases.
Makes sense.
Okay, so number one, of course, is supportive treatment. Okay, so whatever the patient experiences, whatever symptom the patient experiences, we prescribe medications, we prescribe lifestyle prescription to address that specific symptom. Also, steroid therapy is a mainstay. So why is it steroid therapy? Because it's steroid therapy.
Oh,
is an
antihistamine, immunosuppressant.
immunosuppressant and antihistamine.
I hope everything is clicking in your mind now, right? Autoimmune disease, steroids used to suppress is antihistamine.
Antihistamine,
Yeah.
anti-inflammatory medication. So these things. So aside from steroid therapy, we also have immunomodulatory therapy drugs like your DMARDs drugs, your PPAR therapy, and other procedures that manages the immune system. Okay.
So Doc, for you, you're actually using natural PPAR therapy.
Yes.
Your
yes,
PPAR
yes.
therapy is based on as much as possible, instead of drugs, is
Natural.
the foods that you
Food
eat.
that you eat. Okay. Now, there are groups of people where we cannot give immunotherapy. Okay.
That's important to know. And give the audience just one guess. I'm sure you can guess because you understand now, right? The groups of people that cannot use ICI therapy are patients who have autoimmune diseases.
Correct.
Because the side effect of ICI is autoimmune diseases. And of course, based on that, there's another group of people, Doc.
Yeah. Those who have received organ transplant.
Because your organ transplant is considered to be a foreign body,
So,
and if your immune
yes.
system doesn't recognize any of the security pass, it's gonna attack it, and that makes it worse.
Okay. So now we answer the question that we've asked in the previous episode. Why is it that a plant-based diet is so good for immunotherapy?
Yep.
Yeah, it's because a plant-based diet can really make your immunity more hostile to cancer cells, to bacteria, to viruses. It makes it work properly. It makes it work effectively. Okay.
It basically makes your fighting soldiers in your immune system stronger,
Yes.
fiercer. And
Yes.
now that the key way the ICI works is to remove the security pass, you just want these fierce fighters.
To just kill off the cancer. Okay. This is especially useful for more advanced cancers. Okay. Like stage 4 cancers, cancer recurrences, immune checkpoint inhibitor would be more effective in these groups of people. I'll give you an example. Dostarlimab is a very recently tested ICI therapy against colorectal cancer. So the patients, colorectal cancer patients, stage 4, nothing can be done anymore. They received dostarlimab. All of them went into remission.
Wow.
100%.
100% cure rate.
So it's really wonderful on how these drugs can really work in amazing ways.
But Doc, it really also amazes me that all these drugs did was just to expose the cancer.
Yes,
Which
expose the
means
cancer.
the
Yeah.
thing that kills the cancer
Your body.
is
It's
more
your body.
effective than chemotherapy,
Yes.
more effective than anything. It's already in your
It's
body.
already in you.
It's
okay.
already in you.
Now, with the side effects of immune checkpoint inhibitors, right? So we have autoimmune diseases. It's the same. A plant-based diet is so good, no? It's so high in antioxidants, so high in anti-inflammatory nutrients that, you know, it can nullify the side effects of immune checkpoint inhibitors. Why? Autoimmune diseases. Those patients who have autoimmune diseases.
Yeah.
The dietary pattern that they undergo where we see the most remissions is a plant-based diet.
So
Okay? So the plant-based diet is the answer to the side effects of immune checkpoint inhibitor as well. Okay?
So not only does it boost the effect of the immunotherapy, it manages the side effects of the immunotherapy.
Yes. Correct.
So there you go. You know, I see many questions are coming up, Doc. I just want to wrap up before we go into our AMA, which is that immunotherapy works by mainly disabling the security pass that allows the cancer to go undetected. And the case that Dr. Jansen just brought up, the 100% effectiveness on even late-stage colorectal cancer, the killing power is actually in your own immune system. All the immunotherapy did was to disable the security pass. So that goes to show all of us that there are many things that we can do to increase the killing power of our immune system, from antioxidants to so many lowering inflammation and all that, right? Doc, thank you for that wonderful explanation. Now we understand how ICI therapy works, and we know that we can do so much to make it work even better and what to avoid. Yeah, I see the questions are coming in, so without further ado, let's proceed to our Ask Me Anything segment.
Good evening once again to you, everyone. You are now watching the 162nd episode of Simply Nature webinar. So welcome. We are now in the what we call AMA, or Ask Me Anything portion, and I can see a lot of questions coming in. So let's not keep you waiting. Let's call on the expert who will answer our questions for tonight. Once again, our CEO of Simply Nature and PPARS expert from Singapore, Mr. Shyan Lim. Good evening, Sir Shyan.
Good evening, Sheila, and good evening to all our viewers. This is a very interesting discussion, right? For those of you who've always wanted to know a little bit more about immunotherapy, there you go. I think you know not just a little bit more, a lot more, right? But let's go on to the questions tonight.
All right. Okay. So for the first question, Sir Shyan, coming from Ms. Sally Obejas, good eve po. What kind of PPARS is good for bone mets or bone metastasis?
Okay. For bone metastasis, that means you have a cancer cell and other types of cancer that metastasize to the bone, right? So with that, you need to go straight on. The best would be the liquid, all right? But the liquid is, I guess, very okay. Financially, the liquid is the most expensive one. So if money is not an issue, go for the liquid. The protocol will be 1 vial a day. And then you should complement that with tablets, all right? Simply Nature PPAR tablets. So just ask Sheila, just drop a message if you want to know the protocol, and someone will get to you, okay? Now, if you need to manage your financial budget for cancer treatment, and this is something very real, so again, don't worry, guys. We all know when it comes to treating cancer, one of the key factors is, key thing that you need to manage is your finances. Right? Because the strategy in fighting cancer is you got to make sure that you can finish the protocol that you start. You don't want to have something and then it's doing well and then you can't sustain it financially, okay? So the powder extract is also very effective for bone metastasis. So basically, when you have bone metastasis, what you're actually dealing with is not just bone metastasis specifically, right? You're dealing with the cancer that has spread up from its original location. So what you want to do is definitely boost your immune system, because if it has metastasized to the bone, it could metastasize easily also to your liver, to your lungs. And the reason is very simple, right? The cancer cells goes into your blood vessels and then travels to the different parts of your body. All right, and that's why it goes to the bones, it goes to the lungs, the liver, because these are the areas where your blood travels to. That's where your blood travels to. Okay, so I hope that answers your question. Yes, the best PPAR protocol for you would be the liquid. If that is financially very tough to maintain, you can start with the liquid, For example, start with a box of the liquid and then see how it works for you, and then choose a protocol that then is sustainable. For example, the PPAR powder, but always complement it with the tablets, because the PPAR extract and powder activates your systems, but the tablets provides the foundational nutrition that you need, right? It's because I don't know how's your appetite and how's your food intake, your nutritional intake. So having the tablets is like a safety baseline to make sure you get the necessary nutrients that you need, your body needs to function and fight the cancer.
Thank you, Sir Shyan. It's actually a very good question to start off, because one of the main concerns with bone metastasis is actually the pain itself. So, yeah, and I couldn't agree more.
Yeah, I think there was another question that talks about that. Because now bone cancer and bone metastasis, once it hits the bone, it's really, really painful. So does any of our PPAR protocol work directly on the pain? The short answer is not directly. Okay, it is not a pain reliever. So definitely taking your opiates will help with managing pain. All right, it will help with managing pain. But what PPAR does is that it manages inflammation. So inflammation is one of those root causes that will create the pain, right? So if you manage the inflammation, you can also help to manage the thing that causes the pain in your body. Right? But the actual pain itself, that's where your doctor will give you substances like morphine drips and things like that, that will directly, and of course, very strong painkillers, that will directly impact or relieve you of the pain straight away. Okay? So yes, it will help, but not directly for the pain management part. But for fighting the cancer part, yeah, definitely it will provide support for that, and it will boost your immune system, boost your fight against cancer itself. Yeah.
Thank you, Sir Shyan. Sir Shyan, just before we go to the next question, I'd like to greet, of course, our viewers for tonight, starting off with Miss Glenn Regala, of course, Miss Christine Banog, Felicissima Siman, Sofia Clisomocosa, Nelia De Iro, thank you so much for watching, Amelia Rivera, Joy Cabrera, a lot of familiar names actually. Cabel, She, and Sally Ovejas. Thank you so much for watching. You know what, sir? I can see also names who actually came from who came for our SMX last time.
All right. Okay. Hello, everyone. So at least we've met physically. So now we meet Zoom. So it's almost like. All
right. Thank you, sir. All right. Next question coming from Ms. Cabel She. Doc, what kind of PPAR should I take for fatty liver and high cholesterol, metabolic?
Okay, for fatty liver and high blood cholesterol, honestly, okay, I don't know how bad is your fatty liver and how high is your blood cholesterol. Okay, you can start with the soft gel. If it's on the higher side, you can start with the soft gel for 1 month. All right, always couple our extracts, which is soft gel, powder, and liquid, with the tablets. As I explained earlier, the tablets really fuel the process. Okay, now if your fatty liver is something that you will have to address over a longer time period. You know, it's not like you take PPARS and then suddenly your liver, fatty liver just recovers. All right, so it'll take a few months. Why? We're gonna activate your body's metabolic pathways, and it will start to help slowly clear the fatty liver, or help your body get rid of the extra cholesterol. So that takes time, right? It's not a drastic way of reducing your fatty liver and blood cholesterol. However, for most people with high blood cholesterol, within 1 month, it should improve significantly, and within 3 months, it should normalize. Now, when you normalize your blood cholesterol, you will also start to recover your liver. Your liver is one of the most regenerative organs in your body. If you're only left with half of your liver or 1/3 of your liver, within a year, it will actually grow back. Okay, so this is something very good, very important to note. However, you don't want to reach liver cirrhosis. So things like taking lots of alcohol and taking lots of fatty foods, like you already have a fatty liver, you don't want to put it under stress. So whether or not you take PPAR protocols, the first thing you got to do is you got to address and change your lifestyle. Okay, you got to reduce your intake of oils. So I know some people like to take, for example, virgin coconut oil in Philippines because it's very popular and it's very Filipino, right? Because one of the world's top producers of coconut and of course virgin coconut oil. However, if you already have a fatty liver, that's not a good idea. Okay, it's not a good idea to take 2 tablespoons of direct oil into your body. Okay, there are better ways to get the benefits. For example, if you take PPAR tablets, you will get similar benefits to taking virgin coconut oil. However, you don't have to put your liver at risk because you don't have to make your fatty liver more serious. So for those with fatty liver, you really have to cut down your intakes on fats and oils. That's really important. Okay, it's not difficult. It's not difficult. Just watch what you eat. And of course, stop taking so much deep fried stuff. And if you use olive oil, doesn't mean because it's healthy, you can put lots of olive oil, all right? So just watch your oil intake and it should help you recover. Again, once you start on a protocol, plan to go for a diagnostic, right? For example, 2 months after you start taking PPARS, go for another test, another blood test to take a look at your blood cholesterol level so that you will know whether you need to adjust your dosage or not and how you're doing.
All right. Thank you, Sir Shyan. Okay, another interesting question coming from Ms. Glenn Siregala. Hi, is the immunotherapy okay for stage 4 non-small lung cancer elderly patient?
Okay, this part, unfortunately, I'm not an expert on immunotherapy per se. So I will advise you to arrange for a consult with Dr. Jansen. In fact, there are a few questions today. There was another one that was saying that her 2 oncologists, one oncologist surgeon, one is the oncologist, gave her 2 different opinions about which type of drug to use, which immunotherapy drug to use. Okay, Dr. Jansen is very on the ball and on the cutting edge when it comes to chemotherapy and immunotherapy, all right? So have a consult with him because it's easy to talk to Dr. Jansen. That's one. And you tell him the truth, okay? Don't hide it. Tell Dr. Jansen the truth. I don't understand. How come 2 doctors tell me opposite things? All right. Maybe you feel uncomfortable to tell your uncle, hey, how come what you say is different? Why did my surgeon say totally opposite from you? Maybe it's sometimes I know we are Asians, we are shy to tell the doctor, say, hey, doc, did you make a mistake? How come the other doctor told me something? You know, maybe some of us find it very difficult to do that. However, it's very easy to talk to Dr. Jansen. So just go for a consult with Dr. Jansen to clarify these specific questions. Of course, he will ask more questions. You can even ask Dr. Jansen, why did my onco surgeon prescribe me this? And then how come my oncologist prescribed me that? He will take time to explain to you. Of course, prepare your other information when you go for the consult with him. All right?
Thank you, Sir Shyan. Okay. Before I read, before you answer this question, Sir, I'd like to reiterate that what's good about Simply Nature is that we always want our patients to be always in coordination with their doctors, okay? Now, the question is coming from Ms. Nelia de Iro, can I take PPARS without asking my oncologist's approval?
Okay, for, what's her name again?
Ms. Nelia de Iro.
Okay, Miss Nelia, here's the thing. If you will ask me this question, it's because most likely somehow your oncologist may have said something to you which makes you think that he'll tell you no. Right? Maybe your oncologist said something like, while I'm treating you, you don't take any supplements, huh? Yeah, maybe he said something like that. Okay. So you have to make
we understand that, sir.
I understand. Okay, first of all, I understand that. Okay, but here it is. Here it is. Your doctor, for your safety, whatever he's not familiar with, okay, he will tell you not to do it. Okay? So I think let's understand the goodwill of where your doctor is coming from. So I just give you a very good confidence. There was just nice, I think about 4 years ago, I was talking to one of the heads of one of the most senior people in oncologist in the Philippines. All right, he's actually the head of one of the very here. I'm not going to mention his name because I think it's rude. I didn't ask him for his permission, but he is the head of one of the most prominent cancer centers in Philippines. And we were just having lunch together. I was sharing with him what PPARS was, and just nice, she's actually an oncologist herself, all right? And her own parents, one of her parents actually contracted cancer. So she came to know about our product, and she actually asked this very prominent doctor, and just nice, he just had lunch with me like 1 or 2 weeks before. To her, yeah, please go ahead, you know. So what I'm just saying is that your uncle may or may not have heard of us. So whatever, if they have not heard of us, then they will not. They're just being how shall we say, extra cautious. All right. Now, you can always make an appointment with Dr. Jansen. Okay, Dr. Jansen specializes in supporting cancer patients. You can see every week when he's on our program, he's talking about chemotherapy, immunotherapy. He just gave a lecture on immunotherapy. So obviously he knows what he's talking about. So if he's comfortable with our protocols together for a cancer patient when you're going through oncological, that means whatever your oncologist is prescribing to you, then our products should be okay. And Dr. Jimmy Katapia, who's an oncological surgeon who actually administers chemotherapy as well, is using our products to support his chemotherapy patients. And those of you who are at SMX, you saw Dr. Jansen and Dr. Jimmy all sit together on one panel, right? So everybody's there, all friends, nobody's saying no to, saying you're wrong, you know, I don't agree with you. You know, they all held their own position as an oncological surgeon, as a lifestyle and integrative medical doctor, Dr. Jansen, and they all had common grounds because why? They all understood what we are talking about. So your oncologist may or may not have heard of us. So my answer to you is, if you're worried, do a consult with Dr. Jansen, right? Then you will know for sure it's very safe. That he knows that it has no conflict. Oncologist, you can get a second opinion like Dr. Jansen. Okay, from our experience, and because oncologists actually work with us as a company, we're very confident that you can take our protocols with your oncological protocols, with your chemotherapy, with your immunotherapy, and even especially radiation therapy. I hope that answers your question. All right, so the answer is you can, okay? Yeah.
Thank you, Sir Shyan. Actually, since you have already mentioned about the SMX, okay, it got me excited to invite them as early as now, okay?
Yes!
Sir Junie, okay, can we show them the poster? Okay, we are calling on all cancer patients, survivors, and advocates. Let us all come together to explore the latest advancement in cancer treatment. And yes, you'll get that confidence, you'll get that peace of mind, because the doctors that you'll be seeing are not in contrary to each other. They're actually friends with each other as well. So you can have that confidence in whatever next action that you'll be taking after attending the SMX this coming July 27. This is at SMX SM Aura and happening around 8 a.m. So it's actually what our previous viewers or previous attendees wanted really early. Okay.
And honestly, the best thing about this program is you're there live, and all the doctors from different fields are in front of you, so they can't. You can ask them questions that normally they contradict each other, right? Normally you ask onco, they say something. You ask the integrative doctor, they say another thing that's opposite. But when they're all sitting together, you can get the answer that you want. Okay, you can get the answer that you want. So most people enjoy that very, very much. And by the way, guys, I believe it's next weekend. I'm actually going to Mindanao to speak to a group of oncologists. All right, so that's why. Just to let you know, to update you, so that you know that we are actually constantly engaging with the entire medical community, from integrative doctors to pure oncologists to surgeons, so that we can come up with better information for you to make decisions with. so they can be more confident about the choices that you make.
Exactly. Thank you, Sir Shyan. Okay, so once again, that's July 27th. It's a Saturday, by the way, at 8 a.m. at SMX SMR. There you go. Okay, so our next question coming from Ms. Eden Etorne. I started taking PPARS Plus tablets May 10 as prescribed by Doc Jansen after our online consultation. I still have to continue taking my maintenance meds for cholesterol and hypertension, robustatin 20 milligrams and enalapril 5 milligrams. Is that correct?
Yeah, that is absolutely correct. Okay. I just want to let everybody know, PPAR tablets alone, just the tablets alone, it will actually help you manage your metabolic syndromes, which means it will reverse your high blood cholesterol. It will also reverse your blood sugar levels. However, we never encourage people, especially if your case is serious or you've been on medication for a long time. We never encourage people to just go cold turkey, just suddenly stop everything and just take the PPARS. Okay. Can you do that? The answer is yes, you can. Many people have done it and it's safe. But is it the best and safest way to come off your maintenance drugs? No, it isn't, right? You've been taking maintenance drugs for a long time. Another 2-3 more weeks is not going to make a huge difference. What you wanted to do is to make sure that the many years ahead, you no longer take maintenance drugs. That we understand. So the safest way to do it is to go on a step measure, right? Step by step, start lowering the dosage. I believe if you're talking to Dr. Jansen, his protocols are usually between 1 to 3 months. You will be off your maintenance drugs. All right. So you can always give Beth a call, drop her a message if you forgot how Dr. Jansen is going to step or lower your thing, and she can ask Dr. Jansen for you. All right. But I know Dr. Jansen goes by a step by step. That means, okay, after 2 weeks, if you see your blood cholesterol level, everything is okay, good, you can start lowering your dosage. And the target is probably within 3 months, you'll be off your maintenance meds. I'm sure that's what you're going for. So stick with that for now. Okay?
All right. It's always best to surprise your doctors and they will be the one to taper off your medicine.
Yeah, of course. Really borderline blood cholesterol, that even your doctor say, you don't really need to take your maintenance meds, but I'm going to give you anyway, if you're on that kind of very borderline case, then you should at least, number one, you should at least take 30 micro tablets, 10 micro tablets 3 times a day. And if you stop taking your maintenance drugs, when you're such borderline case, then it will actually be okay. Then it'll be okay. But whenever in doubt, just have a consult with Dr. Jansen, okay? Or drop us a message so that we can specifically answer your particular case.
Yes. All right. For those of you who wish to have a consult with Dr. Jansen Kalalan, just type in how to consult, or the link for you to schedule a consult with Dr. Jansen is in the description box or in the comment section as well. Okay, Miss Beth and Miss Irish will definitely get in touch with you individually within this program. Okay, now at this point, another question coming from Miss Glenn Regala. Do you have a list of oncologists that understand Simply Nature PPAR so we could go to them for consult, so we would not hide things anymore?
Okay. I totally understand how you feel, because no, I totally understand, and I'm more power to you. This is one of my personal advocacies, all right, which is, as a patient, you should take control and responsibility over your choices. Because if we just listen to our doctors blindly, if they make a mistake, they don't pay the price. We do. Not only do we pay the price, our family ends up paying the price as well. Okay, so I personally think that as a patient, you have every right to keep asking questions. And if your doctor doesn't want to answer your questions, let me recommend you Dr. Jansen, Dr. Jimmy. They are really fantastic. And we have other oncologists like we have Dr. Ami, who is pediatric oncology. We have oncologists that do work with us, and this list continues to grow. Like I said, this coming Saturday, I'm going to Davao to speak to a group of oncologists. So I would say you have to be patient. So the ones right now that you can easily consult with is if you're looking at chemotherapy, then we'll recommend you Dr. Jimmy. All right. If you're talking about you just want to find out how to support your cancer and you want to also get, like, for example, lifestyle and integrative medicine advice, then I would say consult with Dr. Jansen. But if you're going to administer, that means you want to use chemotherapy, you want to use what shall we say, immunotherapy, then you make a meeting with Dr. Jimmy. Dr. Jimmy usually holds face-to-face, but actually for consultation like this, for chemotherapy, immunotherapy, it's actually possible to do an initial, not face-to-face, but online. Okay, so that will save you time. You don't have to travel and you can talk to them. You can set an appointment and you don't have to wait in queue and everything. So I would advise that. So either Dr. Jimmy or Dr. Jansen. If you want to use chemotherapy, you want a doctor that will apply chemotherapy for you, to you, then Dr. Jimmy. If you have an oncologist that is going to give you the chemotherapy, but you want another doctor who understands how to use PPAR with the chemotherapy, then Dr. Jansen. All right? Yeah.
Perfect. All right. Thank you, Sir Shyan. All right. Another question. A while ago, you've mentioned the VCO, or virgin coconut oil, for the liver, right?
Yes.
Now, the question is, coming from Ms. Susan Cayetano, is it okay for a breast cancer stage 1 to take virgin coconut?
Okay. For me personally, I am okay. I'm okay. But I remember Dr. Jansen, he is very particular about the oil intake. Okay. So if you want to be absolutely safe, okay, there are alternatives to the effects that you want from virgin coconut oil, right? So I think the virgin coconut oil contains the omegas, so does PPAR tablet, but we don't have the high oil and fat content. Okay, so I'm not saying that virgin coconut oil is not good. I'm saying that for the effect that you want from the virgin coconut oil, you can get the similar effects from other natural products like turmeric, all right, PPAR tablets. Okay, so and these other sources of the do not have the problem of the oil. Okay, now if you're just taking 1 teaspoon of virgin coconut oil, I don't think that's an issue. But sometimes, as cancer patients, the dosing is quite high. So I don't know what's the recommended dosage that for virgin coconut oil that you're gonna take. If you're gonna take like 4 tablespoons a day, that might give you that might be that might turn out to be another issue. It might help your cancer, but it will also give you other issues. All right. So that's my advice. Again, virgin coconut oil is a wonderful product. If you don't have cancer, then I think it's a great health supplement that you can take every day. You can lace it on your cereal in the morning, whatever. It is great. But because Dr. Jansen, for dietary purposes, for lifestyle purposes, he always encourages lowering the oils and cholesterol, fats that you take directly. So because of that, I would recommend the tablets over virgin coconut oil or even turmeric. All right. Yeah.
All right. Thank you, Sir Shyan. Okay. Another next question. Tentatively, this will be our last question, but let's see. Okay. Coming from Ms. Christine Banog. How to increase T cells naturally? Sir, can you please explain what T cells first?
Okay,
for those who
T
just
cells are basically your, since we are all not doctors here, then I'll make it easy. It's your Terminator cell, all right? If you watch the movie Terminators, all right? So it's the cell that goes out and attack, the cancer tumors. Now, one way to increase your T cell production is by proper cell delineation. Okay, I'm using a bit technical word, but basically it means this. Your T cells are produced in your bone marrow. Okay, it starts off as a stem cell. So it needs to mature. Marrow, you have to go through kindergarten, high school, and then college. When you graduate from college, you are a full-fledged T cell. If you are a high school dropout, then you are a non-functioning T cell. Okay, you are like a useless blood stem cell, not mature, not useful in society, not useful in the immune system. So one way that you can increase your T cell count, okay, is to make sure all your blood stem cells mature fully into T cells. That is actually supported by PPARS. So PPARS actually helps your blood stem cells mature into T cells. Okay, so that's how you can actually increase your T cell count. Now, if you take things like nutrients, all right, it's not going to help. Okay, the nutrients don't have that function. It is actually a very specific function of PPARS that actually helps cell delineation. That means it helps the proper your cells to mature, the proper maturation of your stem cells. So this is something very specific. So just by eating the right foods, you can't really boost your T cell count. Okay, you will probably need to find specific botanicals. That means maybe in some natural extracts other than PPARS that actually proven to show that increased T cell count. But for ours, yes, it actually increases your T cell activation and your T cell activity. So the answer is, if you really need that, if you're a cancer patient, go for the PPAR powder minimum. Okay, the best is of course the liquid, but the choice between liquid and powder is very financial based. Okay, now even if you're financially very tight but you're in a critical condition, then I would say go for the liquid first. Go for 1 box of liquid, 1 vial a day after 10 days to see the effect that it will have on your body, and then you can maintain it with the powder extract. All right. If you need more help, need more information, simply type into the chat right now and someone will assist you. Or you can go for a consult with Dr. Jansen.
Thank you, sir. Sir, just one last question. Okay, this was thrown to us privately. I'll just mention the first name coming from Ms. Jasmine. Question is, can we combine immunotherapy during chemotherapy?
Can you combine? Actually, the two often go together, but not. Depends, okay? But the usual sequence is chemotherapy first, then immunotherapy. Okay, why? Because they need to weaken the cancer tumor first, break it down first, damage it first, so that it's easier for the immunotherapy to work. Unfortunately, the chemotherapy drug often damages your natural immune system. And as we learned today, immunotherapy doesn't actually attack the cancer tumor. It allows your own body's immune system to attack your cancer tumor. The easiest way to understand immunotherapy is understand immunotherapy as a vaccine. Diba? Your vaccine trains your immune system to attack the virus. So immunotherapy actually makes it easier for your own immune system to successfully target and kill your cancer cells in your body. So the important thing is you still must have a working immune system. So the best way, if you are going for immunotherapy, very often or almost in most cases, there will be chemotherapy first. So you want to take the Simply Nature PPARS during your chemotherapy sessions, so that it protects your bone marrow, so that your immune system is intact. So that when you move to immunotherapy, all your T cells, your dendritic cells, your macrophage cells, they are all still there. Then the immunotherapy will work very well. All right. So we actually, if you're going for immunotherapy, it's 3 parts. It's chemotherapy, PPARS during chemotherapy to protect your bone marrow, and then PPARS during immunotherapy to boost your immune system, and the immunotherapy helps your immune system to target your cancer cells. I hope
That's why they go together.
Clear, right? It works together. Yes.
All right. Thank you, Sir Shyan. All right. Well, that is actually our last question for today. And as you know, our viewers have always been a combination of those in prevention, those already in the journey of chemotherapy or cancer, and of course, those who are already in remission, cancer-free now. Now, I'd like to please ask for a very short parting words for our viewers for tonight.
Okay, before I give my parting words, I just wanted to quickly screen to see if there's any one question that would be very important to the patient that is not easy to find, right? What PPAR should I take for liver carcinoma? Okay, very simple. Go for the liquid, okay? Yeah, go for the liquid. Yeah, let me see what else. Okay. I think we've covered all the important questions today. All right, we've covered most of them. So my parting words is see you next week, guys. And next week, Dr. Jansen will be back to join us. And some of the questions that are not within my area of expertise, because my area of expertise is actually the PPARS. All right. So Dr. Jansen will be able to answer your questions. And yeah, I'll be here. And again, thank you very, very much for always being with us. Today is episode 161, I think.
62. 162.
We've been on the air for 3 years without stop. So thank you very much for your support. Thank you for our long-time viewers. Hope to see you guys in our next face-to-face on-site on July 26th, if I'm not wrong, at SMX Aura. So if you're in Metro Manila, see you in person. Good night and have a good week ahead. We'll be back next week.
Thank you, Sir Shyan. All right, on behalf of our viewers for tonight, thank you, Sir Shyan, for answering our questions. And we look forward for both of you, Dr. Jansen and you, to answer once again our questions for the next webinars to come. All right. I'm sure that you have learned so much from tonight's discussion, because I did. Okay. And at this point, I'd like to invite everybody for our next webinar this coming Thursday. That's May 23, also at 7:30 p.m. The title of our webinar is DIY PAP or Pap smear for cervical cancer. Is it safe? Discover alternative solutions. So once again, this is happening on Thursday, May 23 at 7:30 p.m. All right. I hope that you can also share this upcoming webinar to your friends and loved ones who have cervical cancer, who suffer from cervical cancer. Okay, and at this point as well, I'd like to just say that our products are available via Shopee, Lazmall, and our website, and of course, are directly from our BGC office. Now is the best time to try our products, as the Sulit Sweldo sale in Lazada is still ongoing until tomorrow. So what are you waiting for? Check out our participating products on our Lazmall. Yes, we are very proud to say that we are not only in Lazada, but we are on Lazmall. So you can definitely get your authentic and legit Simply Nature products now. Okay. Now, once again, I'd like to call on our cancer patients, survivors, and advocates. Let us all come together to explore the latest advancement in cancer treatment and engage with multidisciplinary experts dedicated to enhancing your well-being. This is happening this July 27th at SMX SM Aura at 8 a.m. Our panel of experts are composed of PPARS expert, lifestyle medicine doctor, integrative doctor, and surgical oncologist. So take advantage of the face-to-face AMA or Ask Me Anything portion, where you can ask our doctors live during the event. So please watch out for our announcements. Actually, you can message us as early. You can purchase our messages directly, so we can guide you how you can buy your tickets as early as that. Okay. Now, your victories over cancer is what keeps us going here in Simply Nature. And we wish to see you once again in our next webinars to come, because here in Simply Nature, we are always with you from start to healing. Thank you, everybody. Good night, and God bless you all. Welcome to the innovative modalities in cancer treatment.
The 5.9 centimeter mass was gone. I was actually, at this point, I was surprised myself. How can it happen in just a span of 1.5 months? So I asked them, what did your uncle say about this mass? Their uncle said that, yeah, indeed, the tumor was gone. It's just a cavity. It's not enhancing.
Now you know, cancer eats what? Cholesterol, right? Simply Nature people can lower what? Cholesterol. Now you understand why you're taking the tablets? Make sense? Yeah, so more powerful than I tell you this miracle product. Just buy, eat, cure. No, we shouldn't do that, right? Because cancer is not a stationary disease. It keeps changing. So it's best that you understand what's happening, right?
especially if we are talking about solid tumors, the number one modality of treatment is surgery. Then to prevent recurrence, then we do the other adjuvant treatments like chemotherapy, immunotherapy, or targeted therapy, and also radiotherapy.
I have learned the innovative modalities that can be offered to my mom. Tapos on how to take care of ourselves also. Siguro si mom pwedeng sa powder, ako po pwede sa PPARS Plus naman.
Yes, I will invite friends and family members na umattend sa ganitong klase ng ano. Kasi masaya ako eh. Para bang ano, kasi masaya yung outcome, yung staff, helpful, friendly, plus yung ano, yung panelist responsive sila sa mga tanong, plus very honest sila sa mga questions, sa mga pagsagot sa mga questions. Basta, nasasayahan ako. Ganun.
We're always with you from start to finish.